Hi, my name is Olga. I'm from Nightingale College. I'm going to be performing the ophthalmic medication eye drop administration. I will, first off, I will verify the orders in the with my doctor, and I will go over the 6 rights of medication: right patient, right drug, right route, right time, right documentation, and so there's right patient, right drug, right time, right dose, right route, and right documentation. Excuse me. And then I will gather all my supplies. And before entering the patient's room, the medication that we will be giving our patient is Telmanol, which is 0.25% solution. The patient will be receiving 1 drop per eye twice daily. So I will gather my supplies. I will knock and enter into my patient's room. I will close the door for privacy. I will place my supplies on a clean, dry surface, and I will go ahead and wash my hands over here, and I will introduce myself to the patient. Hi, Miss Smith. My name is Olga. Can you please verify your first name, your date of birth for me? All right, I will check the wristband. I will make sure that there's 2 patient identifications. Okay, perfect. All right, Miss Smith, I just want to let you know and ask you, do you have any allergies today? No, any medication, seasonal allergies, or any food allergies that we should be aware of? No? Okay, perfect. All right, so Miss Smith, today your doctor has prescribed you Tylenol, but before I go over that, I'm going to go ahead and check my medication in the MR for the first time. I will do that 3 times before giving any medication to my patient. All right, perfect. Okay, so your doctor has prescribed you Tylenol. It is to treat your glaucoma. That is to avoid to help release the pressure in your eye. Some of this, I'll go over some of the side effects and adverse reactions that you might be experiencing. Some of the side effects would be blurry vision, slightly stinginess. You can have sensitivity to light or any of that. Please let us know if that's happening to you, or a slight headache. Some of the adverse reactions could include a swollen eye, localized, slightly burning, slight headache, or blurry vision. Any of those adverse reactions can be dangerous, so just let us know and we will let your doctor know as soon as possible. All right, Miss Smith, so I'm going to verify for the second time in my EHR for the second time, and I will go ahead and wash my hands here, and I will apply my clean gloves. And before I do that, I'm going to make sure that I bring down the bed. Miss Smith, I'm going to bring down the bed to lay you on your supine. I'm going to bring down the rails. And I want to make sure that you're comfortable. You're comfortable, Miss Smith? All right, perfect. I'm going to hand hygiene. I'm going to apply my clean gloves. And we are going to wash out her eye. We're going to start on the inner calypso to the outer. So I'm going to have it in a white, I'm going to have it in a warm water. So Miss Smith, I'm going to have you look up. I'm going to clean out your eye. Clean before we give the medication. Inner calypso to the outer. I'm going to grab the other corner. Inner So to the outer, perfect. We're gonna dispose of that. We're gonna take off the gloves. All right, Miss Smith, I will be right back. I'm gonna check my computer. This is the third time I'm gonna check and confirm that the patient medication is correct before giving any medication in the MR. All right, Miss Smith, we are going to go ahead and start your eye application procedure. I'm just going to apply that. I'm going to wash my hands, apply my clean gloves. All right, so I just want to let you know before we start applying your eye medication, I want to let you know that there will be some stinginess and burniness, but another thing that we want you to do is try not to blink because we will have to apply the medication again. So I'm going to start off, I'm going to open the cap here and I'm going to grab my tissue here and I'm going to take my non-dominant hand and I'm going to bring down against the cheekbone, or I'm going to bring down and release the conjunctional sac of 1 to 2 centimeters. I'm going to rest it on my forehead with a dominant hand. I'll go beep, okay. And then I'm going to take another Kleenex. I'm going to apply 30 to 60 second pressure. Perfect. Okay, Miss Smith, I'm going to have you blink for me. Okay, awesome. And then I'm going to do the same thing on the other side. I'm going to take a tissue. I'm going to make sure that I, with my non-dominant hand, I'm going to release the conductional sac 1 to 2 centimeters. I'm going to apply the medication. All right. And then I'm going to take my other tissue and I'm going to apply 30 to 60 seconds and make sure that the medication is good in the right area. Okay, Miss Smith, I'm going to have you blink for me. Okay, perfect. How are you feeling? Good? Okay, so then I'm going to bring her up. I'm going to make sure that she's comfortable, and I'm going to bring up the rail, and I'm going to go ahead and dispose these gloves. I will hand hygiene. I will gather all my supplies and make sure that they're in the right area, and I want to make my patient is comfortable, and I am going to wash my hands and I will go ahead and document the procedure. Thank you.